Thank you everyone for joining us this evening. We're going to provide an update on where we are with the Chief Pharmacist Standards. The Chief Pharmacist Standards are part of a programme of work called Strengthening Pharmacy Governance, which you might know as rebalancing. And the production of the Chief Pharmacist Standards are the first phase of this work. So I'm Annette Ashley. I'm the Head of Policy and Standards at the GPhC. And myself and the team are working on the standards. I'm going to introduce you now. We're going to move straight on. I'm going to introduce you to my colleague, Dane Redding, who is going to give us a short presentation on where we are now with the Chief Pharmacist Standards.
Okay, so just to echo what Annette was just saying, thank you so much for everybody for attending this evening. We're going to be now going through a short slide deck regarding the work that we're doing around strengthening pharmacy governance. In particular, we're going to be looking at the Chief Pharmacist Standards. And so just by kind of, again, further introduction, my name is Dane. I'm one of the policy managers here at the GPhC. So I'll just move on to the first slide. So before we kind of dive into the work around strengthening pharmacy governance and more importantly, the Chief Pharmacist Standards, just to provide a little bit of background detail for those of you which have joined tonight and may not have previously touched upon the kind of background on this body of work. So the actual pharmacy order, or the order which has come in, or legislation as we'd like to know it as well, is the Pharmacy Preparation and Dispensing Errors Hospital and Other Pharmacy Services Order. It came in at the end of 2022. And it actually provided the GPhC with further opportunity to strengthen pharmacy governance along with another order as well. And the actual purpose of the order that we're discussing tonight has actually helped remove the threat of criminal sanctions for inadvertent, or what we also might know as accidental or unintentional preparation and dispensing errors for pharmacy staff working in hospitals or similar settings. So one important thing to know about this order is that the actual defences themselves have already been in place for people which are working in the registered pharmacy setting or community pharmacy settings. This has been, I believe, since 2018, and now this order is looking to further extend those defences to people which are working in certain, or what they classify as relevant pharmacy settings, such as a hospital setting, a care home, and places where people are legally detained. So the actual protection from prosecution is as stated in the event of an inadvertent dispensing or assembly error. And what we actually mean by this is that there are still possible threats of criminal sanction that can be taken against an individual that has a preparation or dispensing error, if it's not one which is done inadvertently or accidentally, and also if it doesn't match the criteria which is set out within the order itself. So that's an important thing to remember about it. However, here, what we actually believe at the GPhC is that through the new order and the work we're doing around here, it will actually help kind of strengthen and build a better culture when it comes to understanding of errors and also prevention of errors, by providing a learning culture within these relevant pharmacy settings as well. Furthermore, we believe that this actually increases the opportunities that pharmacy teams have to not only record down such errors, but to also actively learn from them and create ways to mitigate them from happening in the future. So we believe that actually there's quite a lot of good which can come from this work. So when we're obviously talking about the legislation and standards, there are a couple of important or key parts to remember when it comes to the actual defences that you can receive from this. So firstly, there must be a chief pharmacist in order to actually benefit from the defences for the relevant pharmacy settings. And here we have it being defined as a pharmacist who plays a significant role in managing or making decisions in respect of a pharmacy service, with the authority to make decisions affecting the running of pharmacy services and for the ensuring of pharmacy services is carried out safely and effectively. That's quite a wide look at the role of a chief pharmacist and obviously kind of what they do. We recognise that there's obviously lots of subtleties or subtle nuances within there as well. It's just to obviously say as well, more of an interesting point is that it should be noted that the title of CP or Chief Pharmacist is not statutory. And to benefit from defences, there must be someone in post whose job description includes the responsibilities and accountabilities which are set out in the standards that we currently have going through a consultation period. Lastly, just to state as well that, that obviously, as said, the order which came in at the end of 2022 actually has it required that the General Pharmaceutical Council set the standards for chief pharmacists, which is obviously why we're now carrying out this current body of work. So obviously, when we're talking about developing the draft standards, or what we have been doing recently and now, which is at a stage of consultation for chief pharmacist standards, we're looking at the actual defences that the pharmacy team can benefit from with the chief pharmacist in place that is following these said standards. So as stated again, to benefit from the defences, the hospital or relevant pharmacy setting as it's set out must have the chief pharmacist or equivalent in post. So we obviously realise that chief pharmacist may be a terminology that is commonly used. However, across the 3 different countries, there can be other titles used, such as director of pharmacy. So throughout the documentation, you may also notice, or you may have seen, that we sometimes use the terminology chief pharmacist or equivalent. So obviously the chief pharmacist or equivalent, as noted here, must obviously be in post. They have to be registered with us and make sure that they have the appropriate skills and training and experience and meet the standards that we have set out as well for them. And just to say as well, in terms of the standards that we will be moving on to within the next few slides, these are outcome focused and acknowledge the wide variety of pharmacy settings. So whilst at the core, there may be some similarities between certain aspects of work which goes on, say, between a pharmacy in a hospital and a pharmacy service in a prison, there are obviously going to be variations as well, which is obviously why we have a wide variety within the actual standards themselves. We also have included some standards over the next few pages, which then underneath the overarching standards set out examples of how a chief pharmacist can meet these 4 overarching standards. So when we're talking about the standards here, I've just got them on screen for you. So these are the 4 what we would classify as overarching standards that we have developed for chief pharmacists. We're going to go through each one quickly, and I'm not going to go too in depth with them, just going to be providing general overviews of the actual examples that we have included, so as to give you an idea of what we would expect a chief pharmacist must be doing in order to A, firstly, obviously fulfill our standards, and B, secondly, obviously to benefit from defences for them and the staff working underneath them within the pharmacy if an accidental or inadvertent preparation or dispensing error does happen. So the 4 overarching standards here are that they should be providing strategic and professional leadership, develop a workforce with the right skills, knowledge and experience, delegate responsibly and make sure that there are clear lines of accountability, and finally maintain and strengthen governance to ensure safe and effective delivery of services. So when we first take a look at standard 1, here are some examples that we have of how we feel that a chief pharmacist, or what a chief pharmacist must do in order to show that they are fulfilling the standard 1 principles. So we've obviously got a few here on screen, of which I'll just go through with you in brief detail. So we're saying that when we're discussing about strategic and professional leadership, we expect a chief pharmacist to lead an exemplary pharmacy service, providing safe and effective care to patients and public, whilst engaging with other healthcare professionals and innovation. So that wraps up a few of those examples there. However, when we dive a little bit deeper, we then explore the clear understanding of strategy at differing levels, such as organisational, so it could be within the NHS trust that they work within, local or national, can help in actually achieving this expectation underneath these standards. Also being aware of their personal growth is quite an important thing actually within standard 1. So kind of, being aware of what they're doing to help further bolster the leadership that they are providing to the rest of the pharmacy service as well. Also that there should be wider engagement with healthcare professionals where possible. So we understand obviously the role of a chief pharmacist will touch upon not only the pharmacy people or the individual staff that work underneath them, but also in certain circumstances, or in most, it will be a wider team as well of healthcare professionals. So it's about actually how they strategize and work with these other groups as well. And also technology and innovation. Technology and innovation is kind of very big and becoming bigger and bigger throughout the healthcare world. And obviously, we would expect chief pharmacists to be aware of any technological advances or innovations, and to, where possible, embrace them to obviously improve the services, but most importantly, provide further safety aspects towards the patient care that they are providing, or them and their team. When we're taking a look at standard two, so standard two is looking at the development of workforce with the right skills and knowledge. So the previous one we were looking at was focusing slightly on the direct skills of the chief pharmacist and their own growth and how it impacts others and the connections and strategies they make. And this one goes back to more of the skills and knowledge actually within the team in ensuring they have the correct mix. So some of the examples here we're seeing is about the leading by example for being an important consideration, and how they develop the team. And obviously things such as the knowledge of the team's skill mix and how to best utilize these resources, but being also aware of how to support the staff when it comes to general developmental aspects, and considering bigger pictures when it comes to the health and well-being of staff. So quite a lot of kind of considerations and things for the chief pharmacist to be taking on when it actually does come to the pharmacy team that work around them, as well as the kind of like needs of them, not only on a kind of developmental scale, but also actually kind of on a personal health scale as well. We also say that furthermore, it's important to be establishing the correct kind of culture. And when we're discussing culture here regarding the chief pharmacist, it is kind of a multi-layered approach. So not just stopping at creating the right culture in terms of an equality, development, and inclusion aspect, but also kind of going wider about creating a safe environment, which not only empowers staff, but it also provides them with the knowledge of what kind of defences they have available to them, such as this one, which is provided through the new legislation, but also obviously if they need to access it, how they can do so. And more importantly as well, going back to the initial one of the things that we're trying to gain out of this project, which is really the reporting of errors, but also the knowledge about gaining from them and how to prevent them and bolster patient safety and provide an effective pharmacy service. So it's, when we talk about culture, it's a multi-layered approach really for the chief pharmacist within this standard. Next, we have standard three. So when we're talking about delegating responsibility to make sure that there are clear lines of accountability, we're making sure that the chief pharmacist is providing clarity around roles and accountabilities within their workforce. One such way is through risk assessments and making sure that they're carried out by the appropriate member of staff with the relevant skills and knowledge when undertaking such a task. But it can also mean that the chief pharmacist is empowering staff to potentially refuse or find a way to refuse a delegated task if they believe that they don't actually have the right skills within their scope of practice, and if somebody would be better suited. So it's kind of finding a good balance in between really with this one as well. And above all, decisions must be delivered in an effective manner and recorded correctly. So again, making sure that any decisions are kind of backed up and recorded so that they can be reflected on if needs be as well. And lastly, when we're looking at standard 4 about maintaining and strengthening pharmacy governance, or maintaining governance to ensure a safe and effective delivery of pharmacy services, we've obviously got a few bullet points here as well for potential examples of consideration for how a chief pharmacist can meet these standards. So one of the ways is that we expect a chief pharmacist to have effective management systems in place for staff and services, as well as aid a safe and effective pharmacy service through clear lines of reporting and communication. So again, going back to like connecting nicely to the other standards that we've gone through is the point of having the pharmacist kind of creating these clear lines of reporting and communicating, which will obviously help further strengthen the processes that they have in place regarding patient safety and risk, as well as an effective pharmacy service overall. And also a further important point is the establishment of the error incident and intervention reporting, as well as associated feedback models. This could also include regular reviews of governance procedures, which can include the review of things that we classify as a standard operating procedure. Obviously, having these undertaken or firstly developed not only by the chief pharmacist, but also potentially for them to have oversight of a review of them, which will obviously help the drive on improving governance as well as ensuring a safe service is delivered for patients and public. So at this current moment in time, the consultation is live. It is running until April the 16th. And there are a couple of primary views that we're actually seeking through the consultation and the standards for chief pharmacists. So here we've got the four of the main ones that we are seeking the views on. So firstly, we're interested in seeing whether the standards will strengthen and maintain pharmacy governance in the interest of public safety. So again, public safety being one of the key outcomes of us doing all of this work and providing these standards for chief pharmacists and the defences for their staff. However, importantly, it's good for us to know whether the standards provide a governance framework to support staff in reporting and learning from inadvertent preparation and dispensing errors. We see, as I said out at the beginning, that it's a positive thing, and hopefully it will further promote staff feeling empowered to do so, and that the correct environment will be made for them to do so. So it's important for us to understand if this type of framework is going to help actually promote that and create a further, more open culture within pharmacy. And also whether there are any settings which the standards could not be applied and met. So it's also important, as I stated, areas such as relevant pharmacy settings, such as a hospital, care home, or a place where people are legally detained, are some of the primary ones that we've been recommending or saying about in terms of places which are classified within the order. However, there could be other places which are applicable within the order, but our framework may not actually work for them, or our standards may not work for them. So it's important for us to obviously know if that is the case as well. And lastly, we're obviously interested in the impact that the draft standards are going to have for multiple people across the kind of pharmacy world, as well as obviously people engaging with the pharmacy services that a chief pharmacist runs. So we're interested in understanding about the impact for a chief pharmacist, pharmacy professionals, patients and members of the public which use their services, and more importantly, if there's any additional thoughts that we should have towards somebody that might have a protected characteristic. So thinking as well from the equality, diversity and inclusion angle as well. As Annette was saying earlier on, the chief pharmacist standards fall underneath our wider work, which is being performed regarding strengthening pharmacy governance as a whole. So obviously we're developing the chief pharmacy standards as a wider, part of that wider work, which ultimately aims to provide clarity around how pharmacies are organised and manage to help to make sure patients and public continue to receive safe and effective care. So our kind of grand scheme of work is ultimately, like I said, leading back to that patient and public care and the safety of pharmacy services. In addition to the chief pharmacist standards, we also will be developing and consulting on a set of rules and standards for responsible pharmacists, and also standards for superintendent pharmacists as well. Okay, so in terms of next steps, like I said, we had the consultation that was launched on the 23rd of January, and it's open until the 16th of April. After we have closed the consultation, we'll be looking to do an analysis of the responses we've received, and then this will go forward to be presented to our council on the 18th of July. So this is just a quick slide. People on the call today have either submitted their response or are looking to submit their response before the 16th of April. And like I said, we really appreciate getting as many responses as we can regarding this body of work.